Hey, happy Friday, everybody. It's Chamber Check-in time, and welcome to another episode from Idaho's only five-star accredited chamber. Today, I am thrilled, excited. I don't even know the words to talk with Jeremy Maxon today. He's the executive director for Linc. It's a empowering independence organization that's here in Idaho. And Jeremy and I go back maybe 25, 30 years ago. So this is really awesome for me to help share a little bit about Linc, and to introduce Jeremy to the business community through this chamber check-in series. So Jeremy, thank you for coming.
Paul, thank you so much. It is so good to see you. It's always good to spend time with you and to reminisce about all the trouble and mischief that we would get into. We'll just leave it there.
I love it. I love it, Jeremy. Yeah, we even were roommates for a short period of time, and when you're roommates with people, you get to know them really well, and we've known each other for all these years, and it's just a pleasure to know you and to learn from you, Jeremy. So this chamber check-in series is really designed to help share our business stories, their origin stories, their products, services, and most importantly, the people. So why don't you share a little bit about your background and your history of work that led you to Linc?
Yeah, sure. Pretty straightforward story. I mean, I grew up in a small island community in Southeast Alaska and left there when I was 18 to come to Idaho to follow a mutual friend of ours we were just talking about who had moved here the year before to go to Boise State. And I followed him down and attended Boise State and loved it, and stayed in the community and ended up doing a lot of work in the nonprofit sector, I guess. A lot of different types of nonprofit work, but I really like the mission and the focus that Idaho nonprofits across all the different types have, and that kind of just investment of our time and energy into making our communities better. My mom was a nurse for 46 years. My dad was a construction contractor. So grew up in kind of a blue class family, working class family. And my dad was on the city council for a number of years and the school board. And so, a lot of volunteer firefighter, all that sort of stuff. So really a kind of a deep historical commitment to being involved in your community and helping people in your community. And I'm a person with a disability, so I use a manual wheelchair. I've used a wheelchair since I was about 15, and I'm just about 50, so a big chunk of my life, and have had to navigate the world that way. And for a long time, I really wasn't involved really in any way in the disability rights movement. I was just kind of like living my life, trying to do whatever I wanted to do, living independent and as free as I could, having a lot of privilege to do that, despite having a mobility disability that can really impact your world and your life and your opportunities. But about 4 years ago, I had a change in kind of the focus of my work life, and I really wanted to focus on removing barriers that I was experiencing and that I knew a lot of other people were probably experiencing. And so that led me to getting involved in the work that I'm doing now with the Living Independence Network Corporation. So just, really a strong kind of background in history and nonprofit work and trying to just make the place a better place for people, right? We only have so much time on the planet, and I think it's important that we support one another to have as good of lives and community as we can have. So Linc is essentially a regional center for independent living, and what we do, our mission is to empower people with disabilities to live as independent as we want in the community. And that sounds like a really weird, like, well, why wouldn't people live independently in the community? Historically, folks with disabilities have kind of been locked up in institutions and not given opportunities to lead and direct our own lives. That's a lot different today for for a lot of people with disabilities, but there's still a lot of institutionalization and a lot of work that needs to be done to make sure that people are living in their communities how they want, making decisions about their own lives. So what Linc does, we're a nonprofit and we're a chamber member. We love the Boise Chamber and the work that you guys do. And it's really important and really powerful. The business community shapes our landscape in every way. It creates opportunities. The business community can remove barriers. It can strengthen our communities. And so it's really important for us as a nonprofit to make sure we're participating in the chamber and supporting the work that all you do. And as a nonprofit center for independent living, we offer a bunch of different services and programs to basically empower people to be independent, right? Like I said, we cover about a 30,000 square mile area. So Southwest Idaho, all the way from McCall down to Waihee County, over to Twin Falls, Kimberly area, up to Blaine County, Wood River Valley, and then Boise County and back over. So it's a pretty big area that we service, we provide services to. And those programs and services are really wide sweeping, actually. Like we have a really big self-directed in-home care program. So if you're a person with a disability who needs some support, getting up in the morning, or maybe with some chores or shopping or transportation or things like that, then you can access a direct care worker through our program. Okay. And that person helps people stay independent in the community, right? If you don't have a direct care worker, you may have a level of need that puts you in a nursing home or something. And if you're like 20 some years old and you're a person with a disability and you need that kind of support, the prospects of like spending your life living in a nursing home or an institutional setting like that, it's pretty dire, right? And so we try and make sure people have those resources to be in the community, not just in their home, but also in their community. It's really important. We run an independent living program, and we receive federal funds that pay for what are called the 5 core services. And those services are information and referral, peer-to-peer connections or networking, self and systems advocacy work. We help people transition out of institutional settings into the community. So if somebody ends up in a nursing home because of a lack of direct care worker or a medical situation or something, we can help them get back into the community and stay independent in the community. And we do life skills classes as well. So we teach independent living life skills classes. And on top of that, we also run what's called a 5310 transportation program in the Magic Valley. So that's a program that provides subsidized rides, on-demand rides for folks who are seniors or folks with disabilities. That's a really important service down there to keep people connected and getting where they need to go, doing what they want to do. Yeah. We have an adaptive technology program, so you can get durable medical equipment or mobility related equipment. We give out tons of walkers, crutches, shower chairs, bedside commodes. We give out a ton. We repurpose and give away donated power wheelchairs and manual wheelchairs. And these are chairs that cost like $15,000.
Wow.
And sometimes people don't have the resources to access that. And, if you need a wheelchair and you can't, you don't have one, like, you're not real independent. Right. So, making sure that economics isn't a barrier to people and that they have all the tools they need to be safe and mobile, super important. And then we also try and do our best to support the business community with our Access Means Business. And I got to give credit to a friend, Eric Kingston, who lives in Boise, and I'm sure many folks tuning in may know him. And he works in the housing space, and he coined that term, I believe, a while back. But access really does mean business. The folks with disabilities spend, just in travel in the United States, about $58 what is it? It was like $1 billion or something a year. It was some huge number. And if you think about it, like if I go somewhere to a store or a restaurant or go on a trip, or it's not just me. Like I'm going with my wife or I'm going with my friends, and so a lot of people, right? 20 some percent of the population is making decisions about where they're going to go based on whether a family member or a friend can get there. And we, folks with disabilities work and have resources like everybody else, and we want to spend money on stuff like everybody else. You want to go to restaurants, you want to shop retail, you want to go on vacation, travel, stay at Airbnbs. So one of the things that is great about centers like ours is that we can provide a number of services to businesses to help businesses that want to be as accessible as possible, like achieve that goal. Not, in a bunch of different ways. So if you have questions about how, I want to hire somebody with a disability, I got a job that I think would be perfect for somebody with a disability. How do I do that? Where do I spread that word? Can help with that. Maybe you've got somebody with a disability that works for you and you need some support around accommodations, something that we do. Maybe you're not sure if your business is physically accessible, or that you have effective communication for folks who might be deaf or hard of hearing or blind or low vision. And we can come in and help do a technical assessment of your business and let you know, like, yeah, change this, move this, think about this. And oftentimes we can do that just free of charge, depending on the scope of work. We go down and visit businesses all the time and just just check it out and provide feedback to business owners so that they know they're doing the right thing. Those are the sorts of things that we do, not only supporting individuals who have disabilities who are trying to become employed, but supporting those businesses to be more accommodating. I got to tell you, like, folks with disabilities, there can be some challenges, right? It might take a little bit more time. It might take some assistive technology, but people with disabilities are persistent. They have to overcome obstacles every single day. They have to really be committed to making our life work. And those are really super important qualities for certain jobs. And so, I encourage people to look at a disability through a lens of strength, not through a lens of liability or being a time suck or a resource suck or something like that, because it's not really the case. So that's a lot of what we do. We have offices in Boise, Caldwell, Twin Falls, and it's an absolutely fantastic job with fantastic people, with an incredible mission that's really important for a lot of people in our community. Does a lot. You should say something so I'm not talking more.
Jeremy, thanks for educating me a little bit more on Linc too. You really did a really good job of highlighting some of the services that you provide. And I love what it was Eric.
Yeah.
Eric, what he coined, access means business, because that is the truth. If you are a developer out there, if you are remodeling a place, always got to be thinking, hey, all access, right? And I love what you said. It's not just about people who are physically disabled. There may be someone who is hearing loss or visually impaired. And what does that look like in your office? What does that flow of traffic look like when you're walking back and forth? And then the living independent piece. Now that probably covers a lot of different things. And how did y'all fare through the pandemic? What types of things were going on in your community? And how did your team provide resources to, I guess, for lack of a better term, your clients?
Wow, that's a really that is a fantastic question, and literally, like, we could spend weeks talking about the pandemic. Okay. But I'll say, when the pandemic hit, I was working for what's called the State Independent Living Council. So I work for the state as in part as kind of a program specialist around emergency preparedness and disability. And the pandemic hit. I was working for the state, had to go home, work remote, and basically spent every day, 8 hours a day on coordination calls with everybody from the county, city, county, state, and federal emergency response and public health authorities. So it was just literally, we could see the writing on the wall, and that was, people were getting sick. And we knew that if all of a sudden direct care workers that were helping people stay in their homes got sick and they couldn't show up, then there were going to be a lot of people kind of stuck at home. And eventually those folks would need some kind of support. And our concern was that support would come from a 911 call, and that they would end up in the hospital, which of course now you're exposed to more COVID, you're taking up a hospital bed, you're taxing resources from first responders. And that became a really big concern. And that was our immediate concern. Our consumers are a little unique in that they operate under what's called a self-direct program. That means that their direct care worker is largely managed, hired, fired, and managed by the consumer. We do a lot of the back end paperwork, the quality assurance reviews, trainings, things like that. But at the end of the day, you as somebody getting a direct care worker in your home, you set the schedule, you help train them, you decide who's coming and going and when, and you're in control of your life and you're in control of your services. So the folks that we support kind of already had a mentality of being independent and having to be directing their own reality, if you will. And so I think we found that they were a little bit more resilient to what was going on and a little better situated during the pandemic. Now, where we did focus a ton of energy was working with emergency management and the health departments to make sure that the testing, the vaccine or the COVID tests were available, that the drive-throughs weren't the only place that somebody could get a test, that home testing and home vaccination was an option. So we were pushing agencies to think about taking teams of people out into the community to meet people in their homes to do testing or to do vaccinations. We would go out with FEMA, and we had absolutely fantastic partners with FEMA. Huge shout out to FEMA, the FEMA integration team that was in Idaho during COVID, Idaho Office of Emergency Management, John Hanyon with the private-public partnership. You should definitely have him on, who integrates emergency response with the business community. Incredible people that did amazing work through all of that. But we would go out with FEMA and actually ground truth their rural vaccination clinic sites.
Wow.
To make sure that people in chairs could get out there, that they have the right setups, all that sort of stuff. So we were really focused on trying to help the system that's supposed to treat everyone make sure that it was accessible to everyone. And there was a little bit of a lag. There was definitely a learning curve for everybody involved, us included. But the agencies were doing their best to make sure that they were making things accessible along the way. And a lot of it was new, right, to everybody. And so people were, I'm just not gonna fault anybody for delays or hiccups or things that were unanticipated. I really have a lot of positive things to say about the response. So we did also provide a ton of PPE. We had gloves and masks and hand sanitizer, all kinds of stuff coming into our office. We would distribute out through our centers to community members that needed that stuff. And what else? I mean, just everything like that. It was intense. I mean, everybody knows it impacted businesses significantly, and we're still kind of recovering from that. From hiring and staffing to the direct care workforce, which was in crisis during this time and is still recovering. Yeah, it was an educational experience for sure.
And I know Link, thank you for sharing that, Jeremy, because I can't even imagine how it affected, I know it affected us, in your own four walls and the grocery stores and like you said, the healthcare workers and all the essential organizations. But then you've got the entire community that's being affected differently. And thanks
Mhm.
for Link for being there
Mhm.
to help continue empowering independence. Um, I have your website scrolling on the bottom of the screen, and I would encourage anybody else who'd like to learn more about what Link's doing. And there's events, there's upcoming events like your Link Up and Speak Up, the Grow, Gather, and Gab events. You have you have openings for hiring personal assistants in those homes. I'd love to hear more about that. And then we talk about access to business, but what do cities look for as far as access? I know the city of Boise, that's a top priority is access and mobility, because the Valley Regional Transit System, is connecting people to their communities. So how is the city, enhancing its access as well? Maybe for the last couple of minutes, Jeremy, you can tell me a little bit of how Link helps the municipalities get better.
Yeah, great question. I think we've seen a pretty significant uptick in interest and kind of in action from a lot of cities, small cities to big cities across the state. We interact in our service area, but in other capacities here from cities in different parts of the state that really understand the importance of this and are really trying to lean in and do their best to navigate the world of accessibility and access. And I think from McCall to Coeur d'Alene to Mountain Home, Twin Falls, Boise, Meridian, New Plymouth. I mean, across the board, there's a lot of action that's being taken. That's really positive. The city of Boise has a cross disability task force I am privileged to participate on, and that's a conduit for our community to to escalate or raise up issues that we think are important. We want the city to work on. I'll say one huge initiative in the next year or two that a number of different groups are focused on is what's called visitability. And visitability essentially is asking builders and developers to make the very simple and almost virtually, no cost decision to have three design features in all new residential homes. One is to have a zero-step entry somewhere in the home, right? We have a zero-step entry for our cars all the way inside of our garages, and then we build a step into the home. So to get rid of that somewhere, it doesn't need to be the front door or whatever. To make the doors on the first floor of homes 32 inches wide at least, and then having one bathroom that you could get a wheelchair into, so that you can close the door. And those three features don't change the aesthetic of a home or the cost really in any way. There's some upfront design planning that has to happen. But as we look to the future, people should be able to age in place, right? Like, let's say you age in place, something happens and you need an accessible home. You're going to sell your house and dump all your equity into a new, more expensive home, that you may have been, going to rely on for retirement or something. So I think we have to rethink how we build our homes. And this is a big focus of a number of different advocacy groups. I would probably say that's one of the biggest things. And then the direct care workforce. Folks need to pay attention to the direct care workforce issue in the state. We don't have enough direct care workers, and we don't have reimbursement rates through the state of Idaho that are keeping up with inflation. And all of us at some point could need some level of care in our lives, or our loved ones might. And you don't want to wait until you're in that situation wondering why the system's broke, when you've got a loved one that needs support to stay in the community. And I just would encourage folks to maybe look at those two issues.
Wow, you really brought that right to my attention. Residential home builders, that zero level entry, a little bit wider entry. And then I love that comment about the bathroom door, so that actually when you get in through, you can actually turn around and actually shut the door too.
Yeah.
That's huge. And, you know, if you're not in a wheelchair, you're not thinking about that, that's something you could, you know, pass by you. So thank you for mentioning that, Jeremy, because I remember when we lived together, we had the, you know, 12 steps or whatever up to the house. And more courage came to you for letting us take you up and down the stairs. Like that was huge trust on your part from us young kids trying to, you know, get you in and out. And oh my gosh, Jeremy, your friendship means the world to me. I really appreciate you taking the time with me today to help share a little bit about Linc. And I look forward to our next coffee meeting, Jeremy, or happy hour. It's probably more appropriate. And thank you again for your membership. Thank you again for the things that you and your team and your board and your volunteers and your personal assistants are doing to positively impact this community.
Thank you, Paul. And I'm so happy that you are at the chamber. Like you are the perfect person to champion businesses in our community. And I feel the same way. Your friendship is super valuable. And I appreciate you asking us to come on. And if anybody out there feels like they need a service similar to what we offer, please reach out and shoot us an email or a call or a text, and we'll do what we can do to help you out.
Awesome. Jeremy, have a great weekend. And again, I look forward to our next conversation, my friend. Signing out.